All right. Hello, everybody, and welcome to Teaching Tuesday. I'm Justine Bell. We're going to do some quick introductions for the speakers and give you some quick information on how the call is going to run, and then we'll get started. So my name is Justine Bell. I am the health insurance person for Cedar River Insurance, and we are doing a lot with helping people get new health insurance if they lost theirs or keep the health insurance that they have. If you have any questions, I'm the person to ask for that. I'm also going to go ahead and have Katie Krick introduce herself.
Hello, I'm Katie Krick. I'm one of Justine's counterparts at Cedar River Insurance. I'm the commercial insurance producer at Cedar River, so right now we're really focused on helping our clients understand the risks that they might be facing as they continue to onboard their employees back to work, and also just in general, as a resource available to help other business owners examine their risks, COVID and otherwise, that we can help protect. On this call, I will be kind of monitoring the chat box to ask questions to Tracy as it is appropriate for your time. What we'll ask is that if you have a question that is industry specific to what you do, it's best to direct those questions to her privately at the end of the call or in an email. But if your question can be extrapolated across broad industries so that's available and helpful for everybody, we'll definitely address those too. If there's time at the end, we can unmute and kind of open up for a general discussion. That said, please do, if you're comfortable, type your question in the chat box to everyone, not just to Tracy or Justine or myself. That way everyone can benefit from knowing what is being asked and what's going to come up on the docket. With that, I'll hand the floor back to JB.
And I'm actually going to hand it straight over to Tracy. Tracy, go ahead and introduce yourself and then get started. We're so excited.
All right, thank you so much. What I'm going to do is I'm going to share the screen with you at this time. So we're going to go through somewhat of a PowerPoint. The key here is that I'm trying to stay focused on the goals and objectives of what we plan to talk about today, and that is business continuity with safety in mind. And I'm going to go ahead and do that now, and let's get started. Okay, first, before we get into the meat and potatoes of what we're going to talk about today, I would like to thank Justine Bell and Katie Krick with Cedar Insurance Company for having me on today. I feel like a star, so I appreciate that. Just some general housekeeping rules. If you have questions, just to reiterate that, go ahead and put that in the chat box. If you scroll at the bottom of your screen, you should see an option to chat. Throughout this program, it's going to be a little bit different than how I'm used to teaching, which is that face-to-face and in person. I like to have a good balance of pushing information and pulling information back. And I'm going to apologize in advance that a lot of this information will be pushed out to you, but also with the opportunities for you to ask questions. I think that on this call today, we have a lot of great resources. Some of those resources may be from OSHA, they may be HR specialists or health and safety professionals. This program is for everyone. This program is for both employees and employers as it relates to returning to work safely with COVID-19. Now, just to tell you real quick a little bit about myself, I am an OSHA outreach instructor. What that means is that I teach all the rules, safety regulations, certification courses for general industry and construction. I have approximately 20 years experience in occupational safety and health. I actually became a CPR instructor back in 1996, so I know I'm kind of dating myself a little bit here. I also was a previous health and safety director at the American Red Cross, and I'm an active member with the state of Michigan on the Health and Safety Planning Committee for the State Safety Conference. So that's just a little bit about me. I do welcome and open to opportunities for anyone who would like to contact me through Facebook or on that contact information that I provided in the chat box. So these are the things we're going to focus on today, because as you well know, there is a lot of information out there. You cannot turn the corner and see something as it relates to COVID-19. And from a safety professional, I want to be clear to you and say that it is confusing and there's a lot of things we need to know. So we have questions from a safety perspective, and I'm sure you do as well. So these are the things that I really want to focus on today. We're going to first start out talking about your rights and responsibilities from both an employee and an employer standpoint. We're going to talk about some of the record keeping and reporting requirements as it relates to COVID-19. We're going to take a look at respiratory protection. What does that mean if, as an employer, we are requiring face shields or N95 masks? What does that mean as far as compliance with OSHA? And then, of course, most importantly, we're going to start setting the stage to return to work safely. Some of the relevant OSHA requirements for COVID is listed here on your screen. I hope everybody can see that. These things right here, these health and safety regulations, they've actually existed since 1970. OSHA was created, that's Occupational Safety and Health Administration, was created, excuse me, back in 1970 with President Richard Nixon. And a lot of these rules that you see on your screen right now pre-exist COVID-19, but these ones specifically, I don't know if you want to take a screenshot of the PowerPoint slide right now, but these are the ones that will have a direct impact as we develop plans, as we assess our workstations, and we move forward. Some of these things we're going to get more in depth later in the lesson, but first of all, I want to point out the bloodborne pathogen standard. Now, this is a pre-existing health and safety rule that if you have an occupational risk or exposure to blood or other types of body fluids, you're required to be trained in bloodborne pathogens. And in some cases, some employees would also be required to be offered the hepatitis B vaccine. This particular standard, I can see in our future that they may amend or add to it to include airborne pathogens. So as we move forward, we're going to talk about some of these things, and again, get more into respiratory protection and talk about the written plans that are required. Sitting on one of the recent Small Business Association webcasts about returning to work safely, they mentioned that here in the state of Michigan, that they may be requiring workplaces to have a written program specific to COVID-19. And then within those details of having a written plan that's required, you're going to also have to identify someone who is responsible for that plan and who's going to oversee the transition of workers from station to station and to actually fulfill the requirements of what your written policy will be. So when we talk about business continuity and what does this mean for your company? Now, when the World Trade Center was attacked and September 11th happened, the need and the discussion for business continuity was prevalent. There was a lot of lessons learned actually from the World Trade Center as it relates to safety, whether we're talking about the incident command system, communications to an emergency. But one of the key things that stuck out to me was this company, and maybe you've heard about this before, but this particular company, they resided in the World Trade Center. They occupied the floors from 101 to 105. in one of the towers. And what happened here is this entire company was wiped out. Literally. There was, I think, a handful of employees that survived because they weren't in the World Trade Center on that day. And this company lost 658 of their employees, but they also lost all of their database system. That to me would, you know, absolutely devastate a person, an individual that survived that. But in the long run, in the long term, there was a lot of lessons learned from this company. Now, the good news about, if there's any good news about this company in this tragic event, was all of their competitors stepped up. And Cantor Fitzgerald was a bond trading company. When this happened, all of their competitors stepped up and started doing trades and supporting this, really this one owner of the company that was left that wasn't there that day. One of the things about this is your company competitors going to step up and help you have business continuity? And I would like to think that that's the case, but more often than not, our responsibilities are to have business continuity, to keep going even after something major has happened. And I think everybody would agree that these particular times are challenging, that there's fluid information, there's challenges of understanding what's required of you, there's new information that's posted all the time, and we're not even going to get into all the conspiracy theories, but ultimately, it's going to come down to us, our companies, and our employees to continue business as we did before, with, again, all the new challenges. So let's talk real quick about employee rights, and then I'm going to talk about employee responsibilities. Now, these are all things, again, that occurred prior to COVID-19, but this is something that we're really going to have to pay attention to as we return to work. Now, employees have the right to receive training. Now, that safety regulation exists whether we're talking about the use of a respirator, fall protection. They have the right to know what the hazards are, you know, associated in their workplace. And so that's just a given. But as we move forward, you need to consider what type of training are you going to provide to your employees as we launch return to work programs. Now, this one here, providing PPE. Now, as a safety professional, I wake up every day just smiling that people know what an N95 is and the acronym PPE. You'd be surprised. So everybody's heard the term PPE, that's personal protective equipment. Now, prior to COVID-19, the employer is responsible, and again, I'm going to get to some employer rights and responsibilities in a few minutes here, but the employer must provide PPE to the employee. And as you can see here, I have in parentheses, at no cost. There's very little exceptions to this OSHA regulation. And if you're going to require your workers to wear face masks, N95s, respirators, gloves, then again, that's going to be the right of the employee to receive that at no cost to them. As we move forward also in disinfecting workstations, using hand sanitizers, we need to be reminded of the HAZCOM, or what's also known as the employee right to know laws. Every employee has the right to know what type of harmful chemicals or substances that may pose a risk to their own personal health or safety. So those are considerations you're going to need to take if you are using disinfectants, bringing new supplies or equipment or chemicals into your work, and then also having those SDSs or safety data sheets readily available upon request. Now, it is also the employee's rights to file a complaint with MyOSHA and OSHA And in another lesson down the road here, I'm going to talk about where they can find that information, how to file a complaint, where that information should be posted. An employee also has the right to request and speak with my OSHA inspectors and see copies of the OSHA 300 logs. And for those of you that are not familiar with the term OSHA 300 log, I'm going to talk more about that when we get into the record keeping and reporting requirements. So forward and talk about employee rights as we continue. You should know that the employee has a right to get any copies of their medical records anytime that they are sent to an occupational health specialist or medical facility as it relates to an injury or illness on the job. They have a right to see those records. They also have a right to obtain any results that are found from any testing, whether it be air monitoring testing or noise pollution testing, that sort of thing in the workplace. But as it relates to testing of an employee for COVID-19, we want to be really careful as we embark on HIPAA laws, and I'll get to that, I know, again in another lesson. One thing I wanted to point out was the Whistleblower Act, that back in 1989, a federal law was created called the Whistleblower Act. I often ask my students, you know, what's a whistleblower? And I get a variety of answers, but the bottom line is a whistleblower is someone who has filed a complaint to OSHA and MyOSHA. You are protected under this federal law, the Whistleblower Act, where you are free or should be free from any type of retaliation, discrimination, or job displacement because you filed a complaint with MyOSHA or OSHA. Now, a lot of people think that it's only the employer that has responsibilities in the workplace, and that's simply not true. If we take, for example, just the PPE regulations, both the employer and the employee has responsibilities with that standard. The employer has to select it and provide it, pay for it, but the employee has a responsibility to follow all of those rules and regulations. And if the employer has said, I'm going to require employees to wear a mask when they come to work because that's our COVID plan, then the employee has a responsibility to follow all of those general health and safety provisions that your employer has set forth. Okay. Of course, help reducing hazards as it relates to COVID-19. I know there's some companies that are doing medical evaluations prior to entry, testing temperatures. It is the employee's responsibility that if they're not feeling well or if they have fever, that they don't come to work. That's just going to be a common courtesy in the workplace. And again, I'm not going to get into the HR issues such as employees not wanting to come back to work because of COVID, or the other issues that maybe an employee can't wear a mask, that's going to fall under the ADA or American with Disabilities Act. Some other responsibilities that the employee has is that they have to report all occupational injuries and injuries to their employer. Now, if they have contracted COVID-19, there is some presumption laws that we currently have, and OSHA and MyOSHA has relaxed a little bit on their language of enforcement. But a presumption law basically says that, for example, like medical staff, if they got COVID-19, it's presumed that they got that on the job. And we're going to talk more when we talk about record keeping and reporting, because COVID-19 right now is a reportable illness on the OSHA 300 log. Now, I want to draw your attention to the last bullet mainly here. when we talk about employees' responsibilities, it is also the employee's responsibility to have a reasonable understanding that your employer is trying to comply with the new laws or pre-existing laws potentially. If they didn't have something in place before as far as a written program, please know that most employers are trying to work in good faith to do the right thing. And it is the employee's responsibility to exercise your rights with the OSHA Act in a responsible manner. Now, we don't know how many complaints are currently coming in to MyOSHA and OSHA right now, but I do imagine that that's going to be on the rise as we move forward. Now, let's talk about employers real quick. Let's talk about your boss, or let's talk about you, the company owner. You have a right. If you have a MyOSHA visit, if you have an OSHA visit, if you're out of the state of Michigan, you have a right to counsel and ask questions and have an informal conference to discuss what the issues are and what you've done to show good faith that you're trying to comply with the rules. In some cases, when you sit down and talk with MyOSHA over a potential citation or violation, you can simply show them, oh, these are my plans. And even though, for example, we have a shortage in respiratory protection right now because of the commerce issues, not being able, the supply and demand, if you show, hey, I've got this written plan, and our plan is to make sure that everyone is equipped with the appropriate PPE, then again, that shows, in good faith that you're trying to do the right thing. Now, employers also have the rights to form a health and safety committee. I would highly encourage this. If you have a group of people that potentially even work on different shifts that are interested in health and safety in the workplace, sometimes these are the best people that we can recruit for these committees. Now, you can assign people to be part of a committee, or maybe it's just part of your management staff, but everybody has questions. Everyone has a potential solution on how to maybe keep the 6-foot distancing or other, things that you put in your plan to make it happen. So encourage involvement on both the employee and employer viewpoints. Now, an employer also has the right to discuss and correct any violations as it relates to COVID-19. You can discuss that with a lawyer. You can discuss that with your HR committee, and you can discuss that with the MyOSHA representatives. I'm also available in the event that you did get involved with a MyOSHA citation. There's lots of rules to that. I mean, they're required to put that citation in writing. They have 6 months from the day that they come to your work to issue that, and then you have 15 days to respond. So if all this stuff sounds overwhelming and daunting to you, there are plenty of resources. And I'm going to also talk to you about what some of those resources are in just a few minutes. Now, when we talk about abatement, the word abatement as it relates to safety is the removal of. So you have an opportunity to discuss abatement plans, timeframes, but I do want to draw your attention, because sometimes when we talk about OSHA, this stuff is a little dry. I get it, I understand it, but maybe talking about money will help get excited about what I'm talking about here. Now, if your company received a citation from OSHA or MyOSHA, failure to abate, failure to remove a safety hazard, that has a potential financial impact to your company, $12,934. So what we're talking about here, yes, is health and safety and the safety of everyone who comes into our workplace is priority, but you also should look at the financial impacts that the employer might have too. So you have a right from an employer standpoint to discuss those charges, to review them, and to also mitigate those down, and in some cases to nothing. Now, some people laugh when they've seen this slide before when I said the employer has the right to seek professional help. What I mean by this is that there are lots of resources available. Tina with Supplemental CEO is a good example. She is putting together site-specific plans, written plans. She's a resource. You can hire, health and safety professionals. Lots of good resources out there available to you. But most importantly, too, as we move forward, HR policies and hiring people and keeping people. Sometimes when unemployment is, paying such a great rate to stay home, we're going to see our own challenges with the HR policies and hiring people and people coming back to work. So that's another consideration you need to take. But you have a right to hire those people that fit your health and safety motto, that will abide by your written health and safety rules. And then most importantly, especially here in the state of Michigan, with the right to work laws and the other laws that we have, the right to work and what's the other one? I think it's down here. Anyway, we have specific laws here in Michigan that you can discipline and or remove employees basically for just about any reason. Now, what I want to caution with that is if an employee files a complaint and there's an investigation from OSHA, you want to be really careful that you're not violating that whistleblower act and you're paying attention to the dynamics of why that employee is being terminated. But you do have a right for any reason to terminate an employee. So taking a look here with employer responsibilities. When the OSHA Act was signed in 1970, there's the General Duty Clause. Now, the General Duty Clause states that employees have the right to go to work in a safe working condition. So the employer has a responsibility to provide a healthful, safe work environment and to protect employees either through training or engineering controls, administrative controls, or the use of PPE. The employer has that responsibility to provide a safe workplace. Now, when we're talking about COVID-19, again, these are bringing on all new challenges, the ways that infection can occur, the proper use of tools and equipment, and these sort of things. So the employer has to stay up to date, folks. That's really what it boils down to. The employer is going to have to identify again that one person that's identified as the controller of these programs and the controller of the plan, the safety plan at your job. That person is going to have to stay up to date with the CDC guidelines. And from a safety perspective, I've seen numerous changes and guidance that has been put out. So that's going to be an ongoing thing as we move forward. Now, this may pose a big risk to some people and little risk to others, depending on what your workplace looks like, how many employees are sharing tools and equipment, but all things need to be considered. If you have employees using the same tools and equipment, how are you going to disinfect or maintain those tools or equipment? But another issue too is, what if you have workers that typically ride in the same vehicle together? So how are we going to come up with unique and effective means to protect workers. And so those are things that we need to start thinking about under the responsibilities of the employer. Now, the employer has lots of tools and resources, but they also have to supply that information to their employees. And some of the ways that you might be able to do that is to use color-coded posters, labels, warning signs. For example, upon the entrance of a door, you might put mask and glasses are to be worn by all employees and visitors, for example, if that's what you decide is your plan for your job. But that should be posted, and that should be readily available for employees to see that. Do we have any questions at all?
I do. It's just a personal question, and I'm curious. You said the phrasing that you used was, if it is decided that PPE will be required to be worn, then that must be posted and it must be complied with. So the employer has the right to decide whether or not masks will be required?
So it's my understanding that we need to follow all CDC guidelines, not to mention your state's laws and recommendations for the use of masks. I do believe as we move forward, you're going to see the use of masks as a requirement in the workplace as part of those employers' responsibilities to protect employees from this type of illness. So one of the ways that the use of PPE is going to be played out is that employers are going to have to do a job assessment. They're literally going to have to walk through their employees step by step and determine what are the ways that we're going to help mitigate the safety concern. And the current guidelines, from what I've seen, is that the use of masks by all is going to be a recommendation moving forward.
Okay, there's a follow-up question to that. We can all view it in the chat box from Megan. She's asking about legally, Tracy, what are your thoughts on employers being mandated to provide clear masks to all employees if a team member has a hearing impairment, because it would be an ADA accommodation?
Okay, that's a really good question. Now, again, the employer is going to have to assess the risk to the employee. That's part of the written safety procedures. I have a written template that I would like to show you guys if we get time to that. But OSHA specific language talks about, in the written plan, you need to identify the different layers, if you will, of exposures. Some employees have great amount of exposure to COVID-19. Healthcare workers, dental office workers, mortuary services. These are the people that would probably then have to wear the N95s or a higher level of protection than an employee who works in a real isolated workspace with very few people. So there's actually going to be a pyramid, if you will, that's required in your written plans to identify those high-risk employees. So to answer the question, though, more so about the clear masks. Now, I'm not sure that anywhere OSHA or my OSHA is going to say you have to have a clear mask to accommodate for ADA, Americans with Disability Act. If your job specifically requires it or needs it to communicate clearly, then they may view that that's a selection of PPE that they're going to incorporate at their office. I hope that answered that question.
Sure. I mean, we can have the question followed up into the chat box if more clarification is required. Yep. Thank you for speaking to that, Tracy. It sounds like the basic message that you're saying is that within the guidelines that are being published right now and will continue to come out, there is still fluidity in terms of reason and logic is expected.
Yeah.
The employer uses that and applies it to their situation so that we're not requiring office workers to maintain gowns from head to foot.
Correct. And that's what's going to be part of, I believe, the OSHA requirements to return to work. What's your plan? And what level of, PPE is required for this type of worker. And you may find that you have layers of different types of employees, ones that are more exposed and some that are less exposed. For example, the worker that's able to work from home, I don't think they're going to need an N95 or, gowns and masks. Now, part of the old time OSHA regulations and rules, employers, if you hire more than 10 people, then you are required to have written plans and made available to your employees. Now, some of these written plans, for example, could be if you require respiratory protection, they have to have a written plan for that. If they do confined space work, they have to have a written plan for that. So these are, again, pre-existing rules that are now going to also apply to COVID-19. I know I've said this a few times, but employers will have to develop or have someone send a template to have a written plan. Okay, so we've talked about this, about employers' responsibility to examine the workplace. These are often in the safety world referred to as a hazard assessment, where again you identify what the hazard is and basically what we can do to eliminate that hazard as much as possible from that employee. Now, I want to talk about posting OSHA, my OSHA citations, even if it deals with COVID-19 or not. An employer has a responsibility to post all written citations for a period of 3 days or until the hazard is abated. So that has to be in a prominent work area. The same area where you would post the work-related posters. And I'm going to talk about that just for a second here. So in the workplace, already there's a requirement under the hazardous communication standard that your employer has to post the mandatory state and federal posters. It is my understanding that these posters are changing again. These posters, in order for them to be in compliance, they have to be up to date. So if you go to your general prominent work area and you're starting to read the poster and it says that the state's minimum wage is $4.25, then that is not in compliance. Another area that I would like to direct you to for both employees and employers, on these posters, there's an area or space that says, who is your SDS coordinator? Who's your safety data sheet coordinator? That must be filled in. You must have a contact name and a phone number or email to reach that person in the event that the worker wants to know about a chemical or product that's either being newly introduced because of this COVID-19 or it's a product that has been existing the whole time. Now, one thing that I think people are going to be really shocked about is that when you have 10 or more employees, you're required to keep accident and injury logs. And this log is called the OSHA 300 log. Now, some things about that is it has to be posted. The summary of this log has to be posted in a prominent work area from February to April. And this log needs to be maintained for a period of 5 years. I want to go back real quick.
Tracy, can I ask you a question about that?
Yeah.
So you said that COVID is one thing that is applicable to this OSHA 300. Does that mean that you would put a COVID diagnosis on there whether or not the person was at work?
Okay. So this is the specific language from the OSHA.gov website that talks specifically about COVID-19 illness and making it a recordable illness on that OSHA 300 log. Now, the issue about this is that there are very specific rules in how it can be counted as an accident or injury on that record. A person has to be tested positive, has to be laboratory confirmed, and the case has to relate to the job site. For example, if 300 people at, and I'm just making this up, at a meat packaging facility receives, and gets COVID-19, then there may be that presumption that it was something that was contracted on the job and should be a recordable. But those are very case-by-case specific things, because we know that people come and go and stop into Meyer, and with this specific type of illness, it may be difficult to determine if it indeed was a work-related. I talked earlier about the presumption laws. If a medical staff employee who's treating COVID-19 patients gets COVID, then that's a presumption again that they did get it from the job, and it should be a recordable. Now, some kind of cool things about this, and some things I really want to be clear about. I've seen a lot of guidance where different organizations are putting out these templates informing your workers that so-and-so has received or got COVID and it's in your work area and you should know about it. It's these postings. And I want you to be aware that on these OSHA 300 logs, the accident and injury logs, there's two reasons why we would withhold that person's name. Number one, they've been infected with a bloodborne pathogen. They've gotten AIDS, hepatitis, but in that rule, it also specifies and other illnesses. And I would clearly think, even though COVID-19 is not a bloodborne pathogen, that other illnesses would fall into this category. So I would caution putting a person's name on the OSHA 300 log that has indeed contracted and confirmed from the workplace on that log. The other is if someone has had a sexual assault on the job, then their name would be withheld from that information. But otherwise, folks, it's crazy, but it's true. If you died on the job, that's public record. That's public information. You could go to OSHA.gov, myosha.gov, and all their information is there. It says who they are, what company they worked for, what happened to them. So again, a lot of this is public record, and as of March 2nd of this year, OSHA is now requiring employers with 250 or more employees to send those records electronically. So that was a big issue, but it is now finally set into the OSHA rules. When you are putting together these templates of notification if someone has been infected in a work area, I would also encourage you to exclude the employee's name on that. It is the employer's responsibility to be transparent, to be fluid, to have open conversations. But I would just caution with the HIPAA laws and other protective measures that we can say a employee from this department, and maybe they can deduct and see who's not there and determine who it is. But we've done our due diligence to protect that employee's information. Okay.
Tracy, you might get to this later, or it might not be within your purview, but what about for businesses who don't have that many employees, but they have significant foot traffic, like a grocery store or a restaurant or a nail salon or a fitness facility? Are there the same notification requirements or similar notification requirements to employees if, I don't know, because the volume of people is so high? Can you speak to that at all?
I'm not really sure what is going to be required in that regard. I'm just not gonna try to make up something I don't know for certain. I do know that it's perfectly acceptable to post your health and safety rules and requirements, and to also have any contractors or visitors of your company to also abide by your health and safety rules. For those that have contractors that come into your facility, I would encourage you to get ahead of the game, put a little memo or bullet paper together and say, hey, this is so-and-so's plan, you know, this is what's expected. And you could add the signs and symptoms of the disease, but you can also talk about things like, here we have sneezing etiquette. You know, we expect that if you're going to sneeze, you know, do it the right way now. And again, this is going to come through communication and training of everybody involved with your business as we move forward, you know, with the business continuity. So I know I got a couple more slides here, and some of this really gets into the meat and potatoes about setting the stage to return. I want to be respectful of everybody's time, so I'm going to try to get through some of these slides here. When we talk about respiratory protection, this falls under the Code of Federal Regulations 1910.134 for general industry. It talks about two basic types of respirators. One type is air purifying. These are the ones that most people are thinking about right now with COVID-19. I do want to tell you that an N95 is considered to be a respirator. Okay, I'm going to go back here. The other type of respirator that we talk about in the OSHA standards is air supplying respirators. These are the self-contained breathing apparatuses that firefighters use to fight fire. Most of us, hopefully, will not be running around with SCBAs on in our workspace with air supplying respirators. But if you have an N95 on, you have to comply with all of the requirements of this respiratory regulation. 3M masks, N95s, these require certain things of you from the employer and employer standpoint. If you are issuing N95 masks, which these really should be kept for healthcare workers, especially with the supply and demand concerns, if you're supplying the N95 masks to your employees, they're required to be fit tested, folks. There's a training requirement in this regulation, which means that you are training your employees how to properly wear it. Fancy terms, donning and doffing PPE, which just basically means how to put it on and take it off correctly, and also medical evaluations. So when you're looking at, okay, I'm going to need PPE, I need to order this stuff, when you're making your selection, please know that there are some differences in the type of respirators and what's classified as a respirator. Surgical face masks are not considered. These are the homemade masks that all these wonderful people are putting together for people in need. Right now, some of the guidance and some of the information that I've been reviewing does not require all of these things that I speak of, the fit testing, training, medical evaluations, and surgical face masks are not covered under the standard there. Now, there's been a lot of communication on 60 Minutes with the doctor. The WHO organization has put out statements about face masks. And I just want to encourage and let everyone know that wearing a face mask is a courtesy. It's a message that you're sending to other people in your workplace, your employees and visitors of your work, that you care about them and you don't want to spread something that you may not have symptoms for. And of course, we know staying at home is the best way. And then next, having everybody, if you can, have some type of face shield or face covering as we move forward. Now, how long that's going to be in place, I really have no idea, but you do not have to wear a face mask when you're driving down the road in your car by yourself. So there's going to be, again, when to wear it, when not to wear it, how to put it on, when to take it off. Some of the things about respirators that you should know if you don't know already. If you're wearing a face mask, folks, you have to be clean shaven. Now, this again is not new to COVID. This is a pre-existing rule. So those folks out there that have beards or any hair that extends beyond the upper lip, that's going to be part of a written respiratory plan. So if you're wearing N95s, you should be also thinking about shaving to get a good seal and a good fit on that respirator to be effective. Some other considerations both employees and employers need to take is that not everyone can wear a face mask or a respirator. If you think about it in your own personal experiences, sometimes it's difficult to breathe. I have a personal close friend that said that when she puts it on, she just immediately gets anxiety. So what type of reasonable accommodations are you going to be able to make when an employee just flat out can't wear a mask? So those again are going to fall under your HR issues and things that are not part of this program. Please know that if you have employees wearing PPE, there's a beginning training requirement and then an annual training requirement. So if they're, again, wearing N95s for more than 30 days, then all this applies to you, okay? There's some great resources out there specific to respiratory protection, determining the level of protection that you need to work safely. And NIOSH, they have a wonderful worksheet or fact sheet on this. If you Google search NIOSH, which is at the bottom of the screen here, that'll pop up, that respiratory fact sheet. That's a good resource. Of course, CDC is a good resource when they're talking about extended use of a face mask. How long can a face mask be used, and also the maintenance and the shortage issues of masks. Those are all addressed with CDC and at OSHA.gov. Real quick, I want to tell you that when someone is wearing a homemade face mask or even an N95, there is something in the rule book that says an employee can voluntarily wear a respirator. But if they do wear the respirator on the job site, depending on, the N95 or SCBA, they might have to be fit tested, trained, and medically evaluated. So there is an appendix to that standard, and I'd be happy to send that out, that covers the medical evaluation that may be required for an employee to wear it, and also the rules and information on voluntary use. If you have someone voluntarily wearing a mask and they're not required to because they're identified as low-risk employee, you should have a statement on file, and that falls under, I think it's Section D or Appendix D of the volunteer regulation. You can print that form off, and it basically says, we did not say this person needs to wear a mask, but they voluntarily want to wear it. That clears up a lot of confusion if you get a MyOSHA visit and half your people are wearing masks and half your people are not wearing a mask. Again, I think the recommendation is people are going to have to wear masks when we're congregating in the workplace. So we've covered a lot of information here. There's a couple more slides that I think is important. There's some specific things here about elements of a written respiratory protection. I'd be happy to share with anyone who is interested in templates for respiratory written programs, or I also have the COVID-19 written plans if you want those as well. But these are some of the things here on the slide that should be covered. And now, when it comes to enforcement, I think it's important to know that COVID-19 did not take the rules away to comply with occupational safety and health. Although they have put out some wonderful guidance that refers to in good faith efforts and using discretion when enforcing these rules. So as employers are becoming aware that they need to have these things in place, there's going to be some period of time, I think, to adjust and to get these programs off and running. However, I want to go back and say the COVID-19 did not take these rules away, and they are currently enforceable now, but there's some language that is saying that enforcement officers should use discretion and keeping, again, in good faith that the employer and the employees are trying to do the right thing on the job. It is true, and people should know that employees can be written citations as well as employers. We often think of the employer that's getting the citation, but PPE is one prime example of that. If your employer has trained your employees on this type of PPE is needed, this is how you wear it, this is how it's maintained, this is how it's replaced, and the employee chooses not to wear it during a OSHA inspection and ultimate citation, that can actually be issued to the employee. So there's a lot of people that don't know that, but it is true. So couple things now as we return, and I know we're getting close to our time. I only got a couple more minutes here. Set the stage to work. If you haven't done so, start preparing now. Reach out to me, reach out to other workers in the industry that you work in. If you have industry-specific concerns or looking for industry-specific procedures, OSHA.gov has some wonderful resources on there. Right on the homepage, you just type in Google OSHA.gov, and it's going to take you to this wonderful library of industry-specific, in most cases, guidance and written plans. So if you work in a hair salon, a dentist's office, a meat packaging place, go to OSHA.gov. I would start there. I would not create the wheel. I would just modify the wheel. There's lots of templates, again, available for you to do that. Okay. This I think I want to talk about here, and then just real quick, if people are still on and have any specific questions, we'll allow anybody that wants to stay over and look at and talk more in detail with your specific questions. But I wanted to let you know and show you this graph that when we look at the hierarchy of controls, when we look at reducing the risk on the job for our people, this is a format that's used by OSHA and talked about. If we can eliminate the hazard altogether, that's the best case scenario for your employee. Engineering controls is a method, for example, if you are cutting and welding, and if you had a big HVAC system, a vacuum sucking up those fumes, you're using this engineering control to remove the hazard. So maybe at your workplace, you might go through a machine and you're sanitized, or, you know, I don't know what's going to happen as we move forward, but maybe by engineering controls, you can remove the hazard. Next, to keep workers safe on the job is administrative controls. Now, what I mean by this is, for example, scheduling the same people who typically work together. Maybe they're going to continue to have to work together in the same space and basically not cross-contaminate other workers. An administrative control might be, hey, we used to take one vehicle for 2 people, now everybody has to drive their own. Administrative controls also include putting up warning signs and labels about washing your hands and that sort of thing. And then, believe it or not, the very last way to try to protect somebody from disease or from an injury is the use of PPE. That's when we've come to the conclusion that there's no way else we can remove this hazard, and this is our last resort. We know that COVID-19 is something that's not going to go away, at least anytime soon. so we know that we have that hazard. So circling PPE.
I am not hearing Tracy. Is that consistent with you, Katie?
Yeah.
Yeah, me either. We lost her.
Oh no.
Okay, let's give her a minute and see if so much now is dependent on internet connections.
That's true. I'm going to repost, copy and paste her contact information for those who were not on the call when she submitted it so that they can access her later. She's made it abundantly clear that you're welcome to email her directly with questions and any help that you need with that. I like the question about, do volunteers fall under the new rules? So I think we could maybe get a group answer sent out for that. Otherwise, I think we have only industry specific questions that are on the chat. Anyone who's on the call is welcome to include their contact information in the chat box as well, if they want to be considered a resource that the rest of the members on this call can go to. Or you can also just email Tracy directly if you'd like to connect with her professionally. Justine, do you have anything else to add to that before we wrap up here?
I would say that we would love to have your contact information. We're not in regards to a sales thing, but just because a lot of us might be going through some similar things and building these plans together. And so if there is similarity in business type, then that can be something to group with as well. So if you feel comfortable, go ahead and share your contact information in the chat box and what you do. This has also been recorded, so we can pass the recording on to people and they can find you that way as well. I'm so sad because like there are questions that I would love to have answered. So we will follow up with, if you put your information, if you put your email in the box, we'll follow up with any answers that we have for those as well from Tracy when we can get her back. So I'm sure she feels terrible.
I'm
right
so done.
She does. And then maybe not lastly, but for the meantime.
It's just trying to log back in.
Sorry.
I thought I saw that Tracy was trying to log back in, but we lost her again.
Yeah, I do see your face, but not, she's on mute. If you could email myself and Justine, if you have any topic ideas for another interview. I don't know if we'll be lucky enough to get Tracy's time back the next couple of weeks because she's crazy busy. But if there was something else you had questions about or any other ideas for a seminar, we'd be happy to facilitate that with the contacts that we have. Cool. Okay.
I'm so sorry about that, you guys.
Hey.
You know, the worst fears come, you know, to fruition. Sometimes I was like, oh, I hope I don't have a problem with my Wi-Fi.
That is no problem. We're okay, Tracy. We did have a great question though, wondering about where volunteers fall under these rules. Will they have the same requirements as employees?
Well, you know, a former director at the American Red Cross, the #1 work site with volunteers as employees, volunteers should be treated as employees, period. They're people we want to keep safe and protected on our job site. And as a host employer, we have a responsibility to keep workers safe, and that includes volunteers.
A couple of quick questions for you, which are kind of specific, so we can touch on them briefly. What about workplaces that have specific requirements where it would be challenging to wear a mask, like groups that are working around fire or heat? And then a follow-up question to that is, if you have students in the workplace, I know that we've talked about the employer is required to provide PPE, but if you have volunteers and students, is that same workplace required to provide PPE for them?
Okay, so to take the first part of that question, every work is going to have to do a job task analysis. They're going to have to take a look at what the employee is doing and what are the potential hazards, and what are we going to put in place to protect them from that hazard. So that's just steps like 1, 2, 3, identifying if a cotton mask would pose a greater risk or hazard because of their specific job function. Then we as an employer or as a group in our workplace need to come up with the best level of protection according to their industry, whether it's chemicals or fire, heat, flame, those are all, that's a great question. And then the other one was about students. Could you refresh me real quick? What was the question about students?
Yes. So if you have an employee, then that's somebody that you've hired and you're paying, and therefore you are responsible for providing PPE in that certain situation. If you have either students or volunteers, are you required to be providing their PPE, or are they expected to come with it?
Ooh, I might have to defer this to HR, an HR specialist. I'm an occupational safety and health specialist, but I'm going to go on the educated guess and answer that if they're in your workplace, you have a responsibility to protect them or require levels of protection when there's an exposure. I would say that interns, volunteers, student aides are your employees. If they're there creating a function for commerce or even the learning environment, we have a responsibility to look out for those people too. So I would say, yeah, that, you might, at that point, because you're not paying them, you might ask them to bring their own, and it might not be an issue. As long as it meets your levels of protection that you've established for that workplace. Mm-hmm.
And so regulations, or I guess I should say safety plan procedures regarding commerce occurring in your place of business, like the point was brought up, like a dental office, a doctor's office, which is medical, but then also any other commerce at all. The business owner has the right to determine their safety plan. So it would follow that they also have the right to require their clients to comply with anything too.
Yes.
Right? Okay.
That's
Are there OSHA guidelines on that, or is that's not?
So yeah, there's different things that they talk about that when a host employer, let's just use General Motors as an example, if they have a contractor that comes into their work site, they may be considered what's called an exposing employer or controlling employer. The host employer, whoever owns that building, has a requirement to discuss with the contractors and visitors of their buildings what the hazards are, what their rules and responsibilities are as it pertains. And with this COVID, it is my understanding from listening to the governor's address is that places of business and commerce have the right to send people away, and they're not infringing on anybody's rights or anything that I'm aware of. So you can definitely say this is what's required, this is what's needed. And then I would say develop a plan. Look at your workplace. Do you have a lot of volunteers? Do you have students that, need to be protected too?
I have one more question. Is there anything that employers can mandate that employees do outside of work? So for instance, if you have a handful of employees and an employer has concerns about one person's behavior, can they say, like, you cannot gather outside of, like, do they have any say as to what behavior is outside of work, given that it may affect other employees?
Okay, so I have sat in on some conversations with OSHA and my OSHA regarding this just before I actually got on this call. And, I think I want to defer that to your HR specialist at your company. I don't want to say things for certain. And again, these rules may change here and there. So I would like to look more into that deep dive and then be able to provide a more clear answer.
I know it's something that's completely new. I mean, this isn't something that we've really addressed before. So I'm sure everything is constantly changing, tweaking as we go, right?
Absolutely. And that's part of it too, is that, so I'm not one for a lot of change. I've had the same phone company for 20 years, but as uncomfortable as change is, and how bad I feel when I hear things like we're never going to go back to pre-COVID-19, it hurts my heart. You know, I don't like change, but once we realize and accept that change is needed to save our lives or save our own families' lives, if, you know, we can track something on the job and bring it home, it puts it all in a different perspective. You know, we're all in this together. We all got to do things to keep our own personal health and safety. We all have choices to make. You know, will we be returning to work if we don't feel safe? Well, there's actually an OSHA provision that specifically says an employee can refuse work if it's deemed to be unsafe. So
If it is deemed, what deems it?
So an employee can say, I refuse to do that work. You know, like for example, if they're excavating and trenching and they don't have the shielding boxes or protective measures in place, an employee can tell their work, I refuse to do that work. As it relates to this, again, there might be some guidance that's put out about this. You know, right now it's kind of unknown, like how are we going to deal with this absenteeism? I mean, do we have HR policies that says, you know, you can only miss so many days of work? But now we introduce COVID-19. Are you going to relax on those policies? Are you going to say, hey, I absolutely don't want you to come in here if you're not feeling well or have a fever? And how does that work, you know, for your workforce and how many people you have available to do the job you need them to do? So lots of, it's kind of like an octopus, lots of parts to this.
Yeah, it sounds like by and large employers are better off asking you for help, bring you in for a consultation before they really go full bore back into their plan. So thank you so much for your time and your expertise. I know that it was hard to even find an hour to get you because you've been so busy from dawn until dusk, but we appreciate it very much. And
you know, Katie and Tracy, if I may say, I know I'm a new face to a lot of people. Thank you so much. How timely and how wonderful to be offering this to people, because as I'm sure you agree, education is power, and the more we know, the more we can comfortably, you know, look at situations and find our own comfort levels and how we're going to plan to best protect ourselves and others. So I appreciate it so much, and so thank you very much for sharing that with us.
Well, you're welcome, Heather. Thank you. I think we can end the recording now. I will be able to hang back until about 5:30. If anybody wants to continue to talk, that's completely fine, but we are over time, so feel free to step off if you need to. Thank you, everyone who was able to join us today.